is communication in the dental office. And of course, you guys know that communication is very important when you work anywhere, when you work with people in general. Okay, so the learning objectives of this chapter are to learn how to pronounce, define, and spell the key terms, and you guys should have done that already. Describe the importance of understanding human behavior in a business setting. Describe cultural diversity. Discuss communication pathways and identify the differences between verbal and nonverbal communication. Describe the importance of communicating effectively with colleagues. Discuss communicating with patients, including identifying and meeting patients' needs. So a good communication in all forms is the backbone of a well-run organization. Learning about interpersonal communication allows you to communicate what you mean and to interpret what others say and do correctly. The differences must be understood within cultural diversity. So you have to understand gender, race, cultural heritage, age, physical abilities, and spiritual beliefs. So especially working in a dental office, you're going to come across different genders, different races, of course, different cultures, ages. You'll work with children, you'll work with the elderly, and of course spiritual beliefs, because you have to keep in mind people's religions and what they believe in. Okay, understanding human behavior. The collection of actions performed by human beings who have been influenced by a person's culture, attitudes, emotions, values, ethics, and authority. The behavior of people can be viewed as normal, common, acceptable, or even unusual or unacceptable. There have been several psychologists who have been instrumental in researching the way we understand how individuals behave in their personal and professional life. Sigmund Freud, people have conscious and unconscious thoughts, and our purpose in life is to control our instincts and the power of these thoughts. Erik Erikson is a person's identity is individual, and it comes from the past, from one's heritage. Give me 1 second. Okay. So significant people in psychology. Carl Rogers, human beings are intrinsically good and friendly. They are born with these qualities. It is society and their surroundings that diminish these qualities. B.F. Skinner, assume that behavior is learned. Any behavior that is a threat can be changed by learning to solve problems. Positive behavior is acknowledged by positive reinforcement. So we all know that for the most part, yes, behavior is learned. That's what you mostly see in kids. Some kids grow up to be certain types of people because of behavior that they've seen in their homes. So the next person in psychology is Abraham Maslow. He believed that humans cannot live without needs, so he categorized the needs in groups with different rankings. Social attitudes. As a person grows and develops in life, social attitudes begin to influence behavior and a cultural way of thinking. We tend to internalize the attitudes of others around us by making their attitudes our own. Next, we'll talk about peer pressure. We often have the tendency to adapt our behavior so as to fit in with a particular group. Peer pressure is seen when a person conforms to the general behavior of a group of peers in an attempt to feel more acceptable within that group. Peer pressure can have a negative or a positive effect. So generally, with what age group do we see the most peer pressure? You guys can answer.
Like teenagers, like middle school or
yes,
high school?
Yes, usually in middle school and teenagers, because they start to see things within their friends, with people around them, and then they want to be like those people. Okay, so if you guys are following in your books, I don't know if you're following in your books or not. Okay, let's do some recall questions just to see if you guys are understanding what I've been talking about the past 9 slides or so. So does anybody remember which psychologists believe that human beings are intrinsically good and friendly? Go back to this slide right here. Anybody? Everybody sleeping?
I'm gonna say Carl Rogers.
Correct, Carl Rogers. Thank you.
You're welcome.
Okay, so moving on to communication pathways. Effective communication is one of the most important aspects of a dental assistant's job. We spend most of our day communicating with others. We communicate with words, facial expressions, appearance, gestures, mannerisms, listening, voice inflection, attitudes, and actions. The two parts of the message identified above are grouped into the two general categories of verbal and nonverbal communication. Okay, so verbal communication is made up of the words we use. Words are important. Always select words that will not frighten, intimidate, or upset a patient. So like if you're working with kids, if you're working in the pediatric industry, you can never say a shot, an injection, or anything like that. You have to use sleepy juice. If you're gonna be doing coronal polishing, like doing cleanings for them, you have to say that you're brushing it. You don't use words that might scare a child because that's where the fear of the dentist start as children. Your voice quality, okay, sometimes you might go off like you're talking, like you're basically like you're talking over somebody, like you're making yourself seem like you're more important than the other person. You have to watch your tones. And asking questions, closed-ended question and open-ended questions. So the next part is nonverbal communication. And nonverbal communication, of course, is body language, the messages we send, the way we carry ourselves and move about. So even though sometimes nonverbal communication is, you do it subconsciously, some people do pick up on it. So posture, movements, and attitudes transmit major messages. Facial expressions indicate a wide range of emotional states. So I'm the type of person that if my mouth doesn't say it, my facial expressions definitely will. And that's it's hard to control, but you have to do that when you're working in a dental setting because people pick up on it. So that's something that you have to keep in mind when you start working or when you go on your externship. Facial expressions are everything. You can't look surprised. You can't look disgusted. You can't anything like that because people do pick up on it. You pretty much have to have like a poker face, and a poker face means like your face has no emotion basically, except for smiling, of course. So listening skills. To be a good listener, don't let your mind wander. Put aside personal concerns while the patient is talking. So anything else that's been going on in your day or during your day or before your day, you have to put all that stuff aside once you walk into the dental office because your focus should be on your patient and on your job. Don't concentrate on formulating a reply. Concentrate on what the patient is actually saying. You ever hear that you don't hear to listen, you hear to reply? That's exactly what they mean. Look as well as listen. Look as well as listen. Pick up both the verbal and nonverbal information that the patient is transmitting. So these are just more ways to be a good listener. Do not stereotype. A person's appearance, cultural background, race, or religion should not influence your response. It's just like the saying, don't judge a book by its cover because you never know a person's story. Be careful of selective hearing. Sometimes we hear only parts of what someone is saying. You have to be paying really close attention when you talk to the patients. And do not get impatient, especially if the patient is a child or an older adult. If you're ever going to work with pediatric with a pediatric doctor, you have to be very patient with kids because kids are scared. They don't know what's going on. It might be their first time at the dentist. So you'll be in those appointments for a while. Okay. So before we move on to the next slide, can anxiety be communicated through facial expression?
Yes.
Yes, correct. Because facial expressions, they can show your emotions if you're feeling sad, if you're angry, if you're surprised, etc. Okay, so communicating with colleagues, and colleagues, of course, are the people that you work with. Working in a positive, challenging, and stress-free environment is what everyone wants from their place of employment. A patient can tell right away what level of harmony exists in a particular dental setting. Now, I'm going to tell you, yes, this is ideally what you want in your place of employment. Is it what's going to happen all the time? Not necessarily. So the one key to a successful work environment is teamwork. And what do people say? There's no I in team. So being a team member, be flexible and receptive to altering the way responsibilities are performed. Be self-confident and use self-initiative when it's time to get things done. Show appreciation to coworkers. Think before speaking. Do not let your emotions get overly involved. Remember that the first impression is not always the right one. Share the ups and downs of the day. Your way might not always be the right way. So when you're in a team, and you will be in a team, when you work with the doctor usually works with 3 to 4 assistants, sometimes even more. You have to be flexible because not everybody's going to have your personality. Not everybody's going to do things the way that you do them. So you have to be flexible and receptive. And sometimes you'll have to change the ways that you do things in order to better fit into a team. Okay, so moving on. So stress in the dental office. An important aspect of good communication is how you handle stress in your personal life and at work. The dental atmosphere can be a very stressful environment, and this can affect the way you deal with your patients and co-worker. And that is correct. Sometimes you will work in a stressful environment, but that does not mean that you need to change the way that you treat patients or the way that you talk to patients or even treat and speak to your colleagues. Causes of stress in the dental office. Causes of stress include lack of sufficient staff. There will be days where you'll be short-staffed because maybe 2 people off your team called out for whatever reason, and you're going to have to pick up the slack for those people that are missing. So appointment overbooking, usually that happens. Usually if you don't work for a private practice, if you work for like a corporation type office, you're always going to have appointment overbooking because they want to see the most patients as possible. So you will see that a lot in it. Yes, it is stressful. Multiple tasks required simultaneously, lack of good communication, and sometimes that can happen between team members or it can happen between the front office and the back. And the perceived lack of job advancement. Some people have been in the same position for years and they feel like that's just what it's going to be. It's just their job. They're not moving up. That's perceived lack of job advancement. So there's methods of stress reduction. Okay, you can reduce stress by maintaining a lifestyle that includes regular exercise, taking time for yourself, leaving the office behind at the end of the day, which means when you walk out of your office, that's it. You don't think about work anymore. You don't answer anything that's work related. Work is work and it stays at work. But sometimes that, depending on your position in the office, sometimes that's a little bit hard to do. Eating properly and setting realistic expectations. Conflict among coworkers. If differences or conflict among colleagues are creating stress, learn how to work through those differences by engaging in team-building dialogue. Conflict is necessary for effective problem solving and for effective interpersonal relationships. Unfortunately, unresolved conflict tends to escalate, and I've seen that happen. You brush it off, you brush it under the rug, and then eventually it becomes a bigger problem than it is. What is the key to a successful work environment? Does anybody remember?
Teamwork.
Correct. Teamwork. Good job. Okay. Communicating with patients. Effective communication is important in achieving patient satisfaction. Patients who have good relationships, their dentist and the dental staff are likely to stay with the practice, accept the treatment presented to them, pay for their treatment on time, and refer other patients to the practice. So if you have a good relationship with patients, like you become their friends, you see them all the time, they're happy with the service that you give them, they're happy with the team, with the dentist, they usually do always come back and they refer other people that they know to your dentist. Patient needs. Patients build their relationship with their dentist and dental staff through confidence and trust. Patients base their perceptions about a practice on the following factors: how they are treated on the phone. So even though the person can't see you, they can tell if you're having a good day or not, or if you have an attitude just by your voice. People can also tell if you're smiling when you're on the phone, even if they can't see your face. How they are greeted. The front desk is the first, basically the first impression of patients when they come in. How they are made to feel in the office, and how efficiently the staff manages business aspects such as billing and insurance. So if the patient calls or they come in and they have questions about bills, insurance claims and stuff like that, if they're able to get resolution fast, usually that tends to make them continue to go there and refer other people as well. Okay, psychological needs. More obvious when a patient appears tense, suspicious, apprehensive, and resistant to suggested treatment. One major factor is the patient's current life situation. Other important factors are previous dental experiences. We all know that sometimes as adults, we're scared of the dentist, but it's because of something that happened to us earlier in life, and usually it's when you're a child or if you had a really bad experience as an adult that makes us fear more dental treatment. Attitudes and beliefs about the importance of his or her teeth. So once you start getting in the field, you're going to hear people say, well, I don't really care about my teeth. It's not important to me. Growing up, my parents never told me that I had to brush my teeth or that I had to floss. So that's stuff that it takes on, you know, in their life, and that's how they either go to the dentist or don't go to the dentist, either take care of their teeth or don't take care of their teeth. Anxiety and fear of pain. So for many patients, it's the expectation of pain, not actual pain, that causes the greatest distress. So basically, it's because they are working themselves up. Because of past experiences, they kind of they're expecting the worst, is basically what it is. Subjective fears, also known as acquired fears, are based on feelings, attitudes, and concerns that have developed at the suggestion of peers, siblings, parents, or other individuals. So basically, let's say you go to the dentist and you have a horrible experience, like you had a root canal, but the dentist couldn't get you numb because for what XYZ reason. And then somebody else asks you, well, how did it go with that dentist? Then you're going to say, well, it was a horrible experience for me. I was in so much pain, etc., etc. So now you're going to be afraid to go to that dentist because of the experience that somebody else had. So that's acquired fears. Objective fears, also known as learned fears, are those related to the patient's experience in his or her own memories of those experiences. And like I said before, it's usually something that happened to them earlier in life when they were a child or a bad experience as an adult. Dental-phobic patients. For some patients, the mere suggestion of a routine dental visit can bring an overwhelming sensation of panic and terror. Patients with the most severe cases of dental phobia avoid routine treatment completely. They will only seek urgent or emergency treatment with the most aggravated of dental symptoms. So you do see that a lot in the dental office because they're so scared to go to the dentist. They will only go to the dentist when it's too late, when they're already in pain, when a tooth broke, when something major happened. But the trick is you have to do routine exams and cleanings and keep up with your dental work so like that these things don't happen, and then of course then you'll have a reason to be scared or have a phobia of the dentist. So patients responses. Responses are influenced by the patient's total personality and by background experiences. A patient's response to the situation results primarily from causes that are not part of the present situation. So causes are probably not understood by the patient and will most likely remain unknown to the dental team. This is something that happened, an experience that happened a long time ago and they don't really understand, but it's there. The patient's anxieties concerning treatment. Oh, sorry. Sorry about that. The patient's anxieties concerning treatment may result in hostile, irrational, and inappropriate behavior. Hostility is an expression of a patient's anxieties and is not caused by or directed at dental personnel. So sometimes you will come across that. And it's like a subconscious thing, kind of like a defense mechanism. So physical and mental needs. Maintenance of high standards requires sensitivity to the patient's physical and mental needs. The patient's registration form and the medical dental history form should include questions about the patient's dental and medical health. Usually, yes, every patient's chart has a medical history on it and it asks if they've had any surgeries, any illnesses that the office should know about, any medications, etc. Patients with physical or mental impairment have complicated and special needs that must be considered before and during provision of dental treatment. And this is true. You will get patients that are in wheelchairs, people that it's very hard to get any work done on them because of their disabilities or their physical impairment. And usually when that happens, if the doctor cannot handle it, they'll refer them out. Financial needs. Okay, often a major obstacle to a patient acceptance is the cost of treatment. And of course, the patients may believe that the fees are too high, they are unable to afford the treatment, and that they do not need the treatment. And you're going to see this a lot because a lot of people, dental work is expensive. So you're going to see a lot of people that they're not willing to do the treatment because they don't have the money for it. But most offices do offer some type of financing to help them pay for the dental treatment. So many people do not equate dental care with basic human needs, such as shelter and food. Getting people to understand the benefits and advantages of appropriate treatment requires good communication skills. Meeting patients' needs. Positive atmosphere, sincerity, showing respect, respecting the patient's time, resolving complaints and misunderstanding, remaining approachable, and respecting patient confidentiality. Does anybody have any questions?
No, ma'am.
Okay, moving on then. Okay, so for the second part of chapter 61, we're going to be discussing phone skills, which include the following: phone courtesy, handling of different types of phone calls, types of available phone message systems, phone equipment. Discuss written communication, which includes the following: formats of business letters and components of a business letter. We're also going to describe how to market a dental practice, including external and internal marketing. Some of you guys might think that this is not going to apply to you, but this most of the time will apply to you because you guys sometimes will have to do front and back. It's not just about assisting, but it's all around. Okay, so phone skills. The phone is your most important piece of equipment used in public relations. Most patients make their first contact with the dental office by phone. On the basis of this first contact, the patient forms an opinion of the practice. And this is when I tell you that even if the person is not looking at you, they can tell if you're smiling or if you have an attitude on the phone. This opinion reflects on the dentist and dental team and even on the quality of care provided, although no actual care has yet been provided. Etiquette. Smile, it shows in your voice. Never chew gum, eat, drink, or have a pen or pencil in your mouth while talking on the phone. Speak directly into the phone. Speak clearly and slowly. Ask the name of the person who is calling and talk to him or her, not to the phone. When completing a call, always allow the person who originated the call to hang up first. Incoming calls. The phone should be answered promptly, preferably after the first ring. I'm going to tell you right now that sometimes that's not possible, especially if you're in a busy office that has multiple lines and you might only have one or two front desk people. But try to answer, if you're in the front, try to answer as quickly as possible. Use the wording preferred by the dentist at your practice. Sometimes they will tell you like a phrase that you need to say every time you pick up the phone. That depends on where you go though. Greet the patient pleasantly, identify the practice and yourself, and ask how you may help the caller. Okay, so working with difficult callers. Listen without interrupting. Gather all the necessary information, take note of details, sympathize with the caller, and stay calm. If you raise your voice, they're going to raise their voice as well. If you start to argue, they're going to argue. If you talk over them, they're going to get loud. So that never works. Okay, placing a caller on hold. Before placing a caller on hold, ask for his or her permission. Wait for the caller's response before pressing the hold or mute button. If it's one thing that I do not like is when I call somewhere and as soon as they pick up, they say, "Hi, this is so and so from so and so. Can you please hold?" And they just put you on hold. They don't even wait for me to say yes or no. That's a no-no. Always be courteous and do not expect the caller to remain on hold for longer than a few moments. If necessary, ask whether you can return the call and give a specific time when you will do so. So sometimes this will happen a lot. You will call, and because you cannot find an answer to why the caller is calling, you might have to ask for their name, their phone number, best time to reach them, etc., and then tell them that you will get back to them at some point during the day. On-hold message systems consist of recorded messages or music used by the practice to make on-hold time educational and more pleasant for callers than a waiting signal. So sometimes you'll hear music, or sometimes you'll hear some type of advertisement about the practice itself. These messages may explain a variety of treatments and services available at the practice. The messages or musical interludes are broken occasionally by recordings by professional announcers who apologize for any delay and thank the caller for waiting. Callers wanting to speak to the dentist. The dentist should not be interrupted at chairside to come to the phone. Phone interruptions may do the following. They reduce productivity and cause treatment delays, are inconsiderate to the seated patient, make it difficult for the dental team to maintain infection control protocols. And this is correct. If they want to speak to the dentist, just take a message, again, name, phone number, what is it in reference to, and then when the doctor is in their office or outside of treatment, then you refer to them and you let them know that so-and-so called, and etc. The most common exceptions for which a dentist should come to the phone are to talk with another dentist, the dental laboratory technician, or an immediate family member, not to talk to another patient. Taking messages. So make a written notation of all incoming calls, particularly those that require further action. Many practices use a printed form or a phone log to organize this information. At the beginning of the conversation, note the caller's name and ask the appropriate questions. If you promise to follow through on a call, be sure to do just that. There's nothing that makes a patient more mad that you tell them that you will call them by the end of the day and you don't call them by the end of the day. When the dentist is expected to return a patient's call, have the appropriate patient records ready for the dentist when you deliver the message. So usually when this happens, you'll have to pull the patient records just to make sure what was done in the previous visit, what was said, etc. So that the doctor actually knows what he's going to tell the patient before calling the patient back. Answering service. If an answering service is used, learn how to use the services properly. In general, it is necessary to call the service and notify service staff when the office is closing. When the office reopens, call the service immediately to notify service staff that you are back and will be taking incoming calls again. At this time, service staff will give you the messages they have taken during your absence. And this, what they mean by this is like an actual person that takes your messages for when you're not in the office. I will let you know some people don't have that. They just have the answering machine and they will call, they will listen to the messages the next time that they're back in the office and then return the calls accordingly. And this is when this comes in, the answering machine. The message on the machine should provide the following information: the identification of the office, why the phone is being answered by a recording. Usually it'll say you have reached us at after our office is closed, our office hours are, et cetera, or sometimes when people are out to lunch, they'll receive a message on the answering machine. The time at which the office will reopen, whom to contact in case of an emergency. Some recordings usually say, if this is an emergency, please hang up and call 911, and basic instructions on how to leave a message. So voicemail. Many dental practices prefer to use a voicemail service to allow the caller to select a variety of options. Voicemail services allow you to leave a recorded greeting. However, no physical machine is kept in the dental office. So this is just like the voicemail on your cell phone. Somebody calls, if you don't answer, it just goes directly to voicemail. The person leaves a message and you return the call. Messages are retrieved by calling an access number and entering a security code. Patient's preferred method of communication. So collect your patient's preferred method of communication. Do not assume that a single method of communication will meet everyone's needs. So if you guys have filled out any forms lately, you will see on the forms that it'll say preferred method of communication, and it'll say text message, voicemail, or email. And then you pick all the ones that apply. Or if just only one apply, then you just check the one. Emailing and automated dialing services. Email etiquette. Mind your manners. Watch your tone. Even though you're writing an email, people can tell what your tone is by the way that you write. Be concise. Use correct spelling, grammar. Ask before you send an attachment, and wait to fill in the to email address. With a patient appointment phone reminder service, patients can be contacted in a professional manner, reminding them of their upcoming appointment. And a lot of people have that now. They'll send emails to the patients when they're due for their 6-month recall, or when it's their birthday, they'll send them like a birthday card via email. Text messaging. Texting is all around us. Use it for quick reminders, alerts, and appointment confirmations. Can also be used to notify a patient that the office is running late for an upcoming appointment. Phone equipment, okay, and these include headsets. A headset is a lightweight combination of an earphone and a microphone that rests on the assistant's head and allows the person to move about the office and talk on the phone. The advantage of a headset is that the business assistant's hands are free to do other things. For many users, a headset also creates less neck and elbow strain than a traditional handpiece receiver. And you will see these in some dental offices. Phone equipment, the pager. Many dentists need to be on call during weekends or while away from the practice. A pager is a mobile system that contacts the dentist through an answering service or by calling a special number that is left on the answering machine. Phone equipment, or a facsimile machine, okay, a fax basically. Many dental practices work closely with other specialty offices and must convey patient information to other dentists or healthcare professionals. The uses of the fax machine in the dental office can include placing orders with suppliers, relaying and receiving patient information, sending information to insurance companies. Does anybody know what you cannot anybody? I just hear like a beeping sound.
Oh, mine just came back on.
Okay.
The last thing that I heard you say was, "Does anybody know?" And then it went out.
Same here.
Does anybody know what you can you repeat that?
Does anybody know what you can?
What you can't send through a fax machine, that it would be hard for the other person that on the other end that receives the fax to see. No. So actually, you never X-rays because it's just gonna come out like a black fax. Okay, so on which ring should you answer the phone, ideally?
First ring?
Correct, first ring. Who was that?
Me, Yadira.
Yadira. Okay. Alrighty, so written communication. Okay, there are many types of communications. Hold on a second. Am I breaking up?
Yes.
Okay,
Yes.
give me 1 second. Something going on with my Wi-Fi right now. Okay, can you guys hear me now or no?
Yes.
Yes.
Am I still breaking up?
Yes. No.
No. No,
Okay.
you're not breaking up.
Okay. All right. Okay, so written communication. Many types of communication originate from the dental practice. It is important to realize that other than speaking with someone on the phone, written communication is the most important public relations tool of a practice. Whoever has their mic on, can you please turn your mic off? Thank you. Okay, so equipment. If one of your responsibilities in the dental office is to correspond through written communication, you will be required to learn how to use the necessary business equipment within the office. The computer is the operating system used today for all forms of written communication. A copier allows you to make duplicates of documents that must be sent to a patient, another dentist, a dental laboratory, or a supply machine. So when you first go into an office, one of the first things that you will need to learn how to use, of course, besides the dental tools, it's going to be the copying machine, because that's going to be pretty much a lifeline. So business letters. An appropriate business letter is essential when conveying a professional image. Every letter or correspondence mailed from your dental office must be produced on high quality, professionally designed stationery. Letters must be concise, accurate, and neat, and should be proofread for spelling and grammatical errors. Misspelled words and poor grammar convey the image of an office that does not care about quality, and that is true. Okay, so we're going to get into the types of business letters. Many practices send letters to their patients for a variety of reasons, including welcome to the practice, congratulations. You know, the office is small enough that they might send a congratulations for a new job, a marriage, a birthday, like I said, anything like that. Acknowledgement of a referral. If one of the patients refers somebody else to them and that person actually went to your office and became a new patient, you might send them a letter for thanking them for the referral. A completion of an extensive case, continuing care, which is also called a recall, and usually the offices will send those out every 6 months, and it'll say, hey, you're due for your 6-month cleaning and checkup, or etc. If you missed your appointment, they might send you letters, proposed treatment, or a collection of payment. Letters to colleagues. Dentists frequently communicate with other professionals in writing. It is the job of the alert dental assistant to ensure that these communications take place in an expedient and professional manner. Letters to the dentist colleagues may include examination findings or referrals to specialists, and that you will see a lot, referrals to specialists. Important to check for spelling accuracy and consistency when sending written communications to other professional practices. Because what are they going to think of you if it has grammatical errors, or if it has the wrong tooth number on it, etc. Letters to insurance carriers. So when completing written correspondence to insurance carriers, make sure the following items are included: the patient identification information, case information, and radiographs. I will let you know that for the most part is the job of the front desk, but that does not mean that you will never get to do it, because sometimes you will. So the format of a business letter. Using the proper business letter format is one step in making your business more professional. You can simplify the process of creating a properly formatted business letter by using your word processing software program. Choose one of the following formats: block letter format, semi-block letter format, alternative block letter format, or simplified letter format. We're going to talk about the anatomy of a business letter. The components of a letter and its layout on the page are standardized into sections. So the return address, the date, the recipient's name and address, recipient is who the letter is going to, greetings, salutations, the subject, the body, the closing, the signature, and enclosure, and CC, which is a carbon copy. Preparing envelopes for mailing. Place the correct name and address on the front, placing it roughly in the middle of the envelope. Handwriting and non-standard fonts could cause delay. Be sure return address is on an envelope in the extreme upper left-hand corner on front. Apply the correct postage stamp. So most of the time the office will have a stamp that it's going to have the name of the dentist or the name of the office, their address, and their phone number, and that's what you're just going to stamp on the upper left-hand corner of the envelope anytime you're going to mail something out. And then of course always make sure that it has a stamp on it. Okay. Marketing your dental practice encompasses all activities involved in attracting new patients to the practice and retaining satisfied ones. Initiation and development of a marketing plan are the responsibilities of the dentist. For a marketing plan to be successful, all members of the dental team must be actively and enthusiastically involved in planning, implementing, and monitoring the plan. So marketing can be social media ads, flyers. Some people have like some type of mascot, or some, if you can call it that, like a person in a costume standing outside, waving a sign, etc. Goals of practice marketing. The primary goal of marketing plan is to create a positive image of the practice where patients receive quality treatment in a caring atmosphere. The positive and cooperative attitudes of all staff members are vital in successfully creating this image. A secondary goal is to enroll new patients at the practice. An important part of achieving this goal is to determine the perceived needs of potential patients and seek out ways to meet these needs. The logistics of marketing. Most practices with successful marketing programs attribute this success to a good organization, attention to detail, determination of a budget, and tracking of the results. The plan. Written goals and dates must be established. Marketing budget. Average ranges between 3% and 5% of the previous year's gross revenues. Tracking responses determines the success of the marketing plan. Types of practice marketing. External marketing activities take place outside the office and are directed to people who are not patients. And this is when you get the flyers in the mail that it says we're brand new opening or new management, etc. And it'll have like a flyer of a new business, a new dental office that just opened. They're trying to, it says like free x-rays and exam or etc. That's basically external marketing. These activities include health fairs, and that's when you go to a health fair, and you see the practice standing with their table, and they give away like goodies to the people and get their information, etc. And presentations to school children or senior citizen groups. So I don't know if any of you have small children. Sometimes the daycares or even the schools, they get like a dentist from a particular practice in the area to go speak to the children about brushing their teeth and flossing, etc. And that's basically marketing for their business, because if they get comfortable with the children's gonna say, hey mom, look, I brought this paper today of a dentist that went to the school to talk to us about brushing and flossing, etc. Maybe we can go here, etc. And then the parent would want to maybe take their child there. So that's one of the activities with marketing. And external marketing activities may require staff members' participation in the community. Some dental offices, they do community work. I know that the office that I used to work for before, once a year, they used to do this, I don't remember what it was called, but they used to do like free dental work for people who didn't have the money to do it. And it was more kind of like for homeless people and stuff like that, where they would do like x-rays, they would do the exam, they would take care of any immediate pain that the patient had, like if they needed an extraction of a tooth, that would happen that day and it would be at no cost to the patient. Okay, so internal marketing strategies are those activities and promotions that are targeted to current patients of the practice. So publishing a practice newsletter, they'll give it to the patient directly when the patient shows up, but they'll send it sometimes they'll send it in the mail, and it'll tell you anything that's going on within the office, if a new doctor is joining, if they're like revamping their office or etc. Developing promotional materials for insertion into monthly statements. Okay, sending flowers or other appropriate thank you gifts to those who refer new patients to the practice, sending birthday or other special occasion cards to patients, and sponsoring giveaways, office open hours, and other promotional events. The dental office newsletter. The newsletter represents a valuable communication tool for the practice. The purposes include the following. Keeping patients aware of new technology and treatment advances. They can, the newsletter can say, oh, we have this brand new x-ray machine that does this or that, or it can be if they just started doing a system where they are doing like this new no drill cavity, like fixing of cavities with no drills, but they do laser. Some people are now doing like a laser technology. So that can be that. Keeping in touch with the dentist and members of the dental team. Listing patients' names as referral sources or contest winners. Names are used only with the patient's permission, of course. You can't have somebody's name or last name, on a newsletter and everybody can see it. Announcing other changes that have taken place within the practice. Like I said, new doctor, they're remodeling, new technology, etc. Okay, and then patient education materials. These are printed pamphlets, brochures, and statement stuffers. So sometimes in some offices in the waiting areas, you will see different pamphlets and brochures of different services that they offer. Like, let's say it can be a pamphlet telling you about veneers, or telling you about fixed bridges, or telling you about braces, or depending on what they do at that office. Okay, so that is that. Does anybody have any questions?
I don't at this moment.